My name is Amanda. I'm with the Tampa Hills County Public Library, and today we are very happy and very honored to have Kaylee Mail, who is with us on behalf of the Alzheimer's Association of the Florida Gulf Coast. She's also a clinical research coordinator and director of marketing and research at Axiom Clinical Research. Today, she is going to be speaking to us about Alzheimer's and dementia. So before we get right into the information of the program, I do want to share with you, actually, let me go to this. I do want to share a book shout out with you for our collection. So this is a topic where you can find more information in the library collection. Based on today's topic, we're sharing a book that you can find in our ebook streaming service from the Mayo Clinic, and it's the Mayo Clinic on Alzheimer's disease and other dementias. This is just a basic book to give you the outline and information about Alzheimer's disease and different dementias. And one thing to let you know, we're sharing, this is on our Hoopla streaming book platform. There is never any wait on Hoopla. So everybody who attends the program today, if you want to go check that out, there will be zero wait. You can all check it out at the same time. Okay, but without further ado, let me pass it over. I'm going to go ahead and bring up the main PowerPoint, and let me pass it over to Kaylee, who is our expert on this topic. Thank you so much, Kaylee.
Well, good morning, everybody. Thank you again very much for having me. So today we're going to be talking a little bit about understanding Alzheimer's disease. And normally, if we were in a group setting where you were in front of me, I would ask you to raise your hand if you've been affected personally by Alzheimer's disease. And typically, there's about between 75 and 90% of the room raises their hand, and they say either maybe a parent, a sibling, a friend, they know of someone who has been affected by Alzheimer's disease. So if you take anything from this presentation today, I just want you to know that there are other people in the situation that you are in, and that you're just not alone. So I hope to share with you some information that will help you to both understand the disease and also to find out about the resources that are locally available to you. Next slide, please. So the impact of Alzheimer's disease, we know that this disease does not discriminate. It doesn't even discriminate by age, which we'll get into a little bit later. Typically, this is thought of as the older person's disease, but I will share with you that is absolutely not true. Next slide, please. Okay, so we are going to go into another polling question here just to get an idea of where everybody's at in terms of understanding of the disease. So we will go to our first polling question. How many Americans are currently living with Alzheimer's disease? So go ahead and select your choice, and we will leave it open for a couple of seconds so everybody has a chance. So option A is 850,000, option B is 5.8 million, option C is 12 million, and option D is 3.4 million. So we'll give everybody a quick second here.
And then Kaylee, we're not getting as many answers yet, but I will let the audience know the polls that pop up on your screen, feel free if you want to answer. All you have to do is click on your answer and click submit. And that's all you have to do.
Okay, great. I'll give everybody a minute here as the first one.
Oh, and it looks like, okay, it looks like we do have an answers there. So I'm going to go ahead and close the poll and share the results.
All right, so, everybody got it correct, so wonderful. There are currently 5.8 million Americans living with Alzheimer's disease, which is a staggering number. We know that that is a lot of people, again, just to reinforce the fact that nobody is dealing with this disease alone. So now we can go to the second polling question, please. How many unpaid Alzheimer's caregivers are there in the United States? So we just discussed in the last question that there are 5.8 million Americans that are affected with Alzheimer's disease. So how many unpaid Alzheimer's caregivers are there in the United States? Option A, 1.2 million. Option B, 8.5 million. Option C, 13 million. Or option D, 16.2 million. Okay, so we have a few answers in. The predominant answer is 13 million, but actually the answer for this one is 16.2 million. So think about that in terms of family members, spouses, friends, neighbors, for caring for those 5.8 million Americans. There are nearly 16.2 million caregivers that are unpaid. So those are not, home health staff or anything of the like. Those are just individuals who are offering their care for free. So that'll give us a little bit of context moving into the rest of our presentation, but we'll go ahead and move forward. We're going to show a quick video now just to give you a little bit of facts and figures about Alzheimer's disease. Now, this video moves a little bit quickly, but I like to just pick out one or two things that really stand out to me. Okay, so I hope that most of you were able to see the video. So the thing that stands out to me the most from that one, just as a quick review, Alzheimer's disease is the sixth leading cause of death in the United States. And to me, I feel like it's something that we don't hear about very often. It is still one of those diseases that might have a little bit of a stigma attached to it. And I'll also mention too, it is the only disease in the top 10 causes of death in the United States that does not have an effective treatment or cure. So those sound like kind of facts that don't make us very happy, don't give us a lot of hope. But I do hope that throughout the course of this presentation, you get some ideas that there are lots of things in the works, and there's lots of support and services that are available to you. Next slide, please. Okay, we're going to go into another polling question. True or false? Alzheimer's is a normal part of aging. Okay. We have the correct answer, which is false. Alzheimer's disease is not a normal part of aging. And I believe we have one more polling question in this section. True or false? People younger than age 65 can get Alzheimer's disease. Okay, correct again. So that is true. People younger than age 65 can get Alzheimer's disease. We've even seen people diagnosed in their 40s as early as. So most certainly this is not just a disease that affects people that are older than age 65. Okay, can we go back just one slide to the umbrella, please? I think just one more. Okay, yeah, right here. Okay, so this is a graphic that I like quite a bit. So if you see, dementia is shaped kind of as the umbrella in this case. One of the questions that I get asked most often is, are Alzheimer's disease and dementia the same thing? And the answer in that case is no. So we think about dementia as a collection of symptoms. So the official definition to dementia is a general term for the impaired ability to remember, think, or make decisions that interfere with activities of daily living. So dementia is not a specific diagnosis. I want you to think about it a little bit in terms of if you heard that a friend or a family member was diagnosed with cancer, you would say, oh, okay, well, what type of cancer? I want you to think about dementia in the same way. So-and-so was diagnosed with dementia. Okay, what kind? So you see underneath the umbrella that there are several kinds of dementia: Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia. And believe it or not, there are over 100 different types of dementia. So that may seem a little bit overwhelming, but this is helpful in terms of diagnosis and also in terms of categorizing symptoms. So we know that each type of dementia will have its specific symptoms that are associated with it. But dementia is just a collection of terms, a collection of symptoms, but it's not a specific diagnosis. Next slide, please. Okay, so again, just to reiterate, dementia is a general term for a collection of symptoms that are severe enough to interfere with daily life. Alzheimer's is the most common cause of dementia, and the statistics are between about 60 to 80% of most types of dementia is Alzheimer's disease. But that still leaves us with a good chunk of disease that we don't always talk about. You know, we don't always talk about Lewy body dementia. We don't always talk about frontotemporal dementia. So just know that they are in the same category, but not the same disease exactly. So Alzheimer's disease is not a normal part of aging. It is a progressive brain disease. Next slide, please. Okay, now we're going to talk a little bit more specifically about what Alzheimer's disease does to the brain. Next slide, please. Okay, so this is a bit of history about Alzheimer's disease. More than 100 years ago, Dr. Alois Alzheimer described specific changes in the brain with the formation of plaques and tangles. Now, that can be a little bit confusing to think about, but if you think about going to the dentist, you go to the dentist to clean the plaque off of your teeth. Think about it in a similar way for plaques that are forming within the brain. So we know that if we don't clean the plaque off of our teeth, it can lead to cavities. A similar thing in the brain that if we are not able to, which right now there is no scientific way for us to clean the plaques out of our brains, but it can lead to buildup and it can lead to miscommunication in the brain. So Alzheimer's causes the nerve cells to die. And nerve cells do a lot of different things for our body. They do speech and communication. They let us know when certain things need to happen inside the body. And the brain actually shrinks because these cells are dying. And these brain changes can result in changes in memory, thinking, and behavior. And the behavior portion is particularly interesting with some of those other different types of dementia that we mentioned at the beginning. Next slide, please. Okay, so now we're going to talk a little bit about the risk factors associated with Alzheimer's disease. Next slide, please. And I believe we have another polling question. What is the greatest known risk factor for Alzheimer's disease? Is it genetics, family history, or age? I'll give everybody just a minute here. Okay, so we have an answer of family history, but for this one, actually the greatest known risk factor for Alzheimer's disease is age. So we'll talk about a little about why that is in a moment. Okay, so certain populations are at a higher risk of developing the disease. Hispanics are about 1.5 times as likely as whites to develop Alzheimer's and other dementias. African Americans are about twice as likely to develop the disease as whites, and almost 2/3 of Americans with Alzheimer's disease are women. And now the biggest question we get when we talk about these sorts of things is why? Why is it that certain groups of people are at a higher risk of developing Alzheimer's disease? And the easy answer to that is we're not entirely sure. There are many, many research studies ongoing right now to see why it is that certain groups of people, and even why women, are more likely to get the disease. So that's the easy answer. If anybody has any specific questions at the end, we can go into it. But this is what we know as of right now. Next slide, please. Okay, so just as a little bit of a recap, age is the greatest known risk factor for Alzheimer's. An individual's risk for developing the disease increases at age 65. Family history is also a known risk factor, but it's not the greatest risk factor. So having a parent or sibling with the disease increases an individual's risk. Now, this is a between 2 and 5% increase in your risk. It is very small, but it is slightly increased if you have a parent or a sibling with the disease. So there are certain types of genes associated with Alzheimer's disease. I won't go into that very specifically, but there are certain genes that can increase your risk, but don't necessarily mean that you're absolutely going to develop the disease in your lifetime. And we do know that Hispanics, African Americans, and women are at an increased risk for developing Alzheimer's disease. Next slide, please. Okay, so now we're going to talk a little bit about the stages of Alzheimer's disease. Now, I will say before we get into this portion, these are very loose terms. So the stages of Alzheimer's disease aren't always used by physicians, but this is just to give an idea of what the disease might look like for some people. Next slide, please. So when we talk about the early or mild stage, the person is able to function independently, but may have some issues with their short-term memory, issues with concentration, finishing tasks, and trouble remembering new information. So a lot of people say, okay, well, what's the difference between that and normal aging? Because quite a few people do develop some of those things as they age. So it's important if you feel that there is a sudden, increase in not being able to remember things, or, you're having a hard time doing things that you've done your whole life, that's when we need to start to speak to a doctor or start the conversation with somebody in our life that can lead us in the right direction. So I will say with that one, certainly after age 65, if you are a Medicare recipient, there is a mandatory memory screening that is supposed to happen at every visit with your primary care physician. So many people don't know this, but if you are 65 or older and are on Medicare, your primary care physician should ask you if you would like a memory screening, and I would most certainly say yes. Even if you don't feel like there is any changes in your memory or thinking, it's also very good to have a baseline. So if in a few years you are having some issues with your memory, they can refer back to this initial test. So we can talk about that a little bit more later. But the middle or moderate stage, sometimes there is confusion with words, maybe some personality or behavioral changes, forgetfulness of events or personal history, and perhaps changes in sleep patterns. The late or severe stage, the individual might require around-the-clock assistance. They might be unable to respond to their environment or hold a conversation. And they might be unaware of recent experiences. So this is not necessarily a typical or path that every single person that develops Alzheimer's disease will take, but it's just an example. Next slide, please. So there are 3 stages of Alzheimer's disease as we just discussed, mild, moderate, and severe. And no two individuals experience the same symptoms and progression of Alzheimer's disease in the same way. That's a really important point. Um, just to say that just because you know someone with Alzheimer's disease, you know one person with Alzheimer's disease. So everyone will have a different course. Their timeline will look different. Their medications will look different. So it's important to keep that in mind, because everyone, as we are individuals living without Alzheimer's disease, individuals with Alzheimer's disease are just the same. While symptoms may worsen over time, people progress through stages at different rates as their abilities change. Next slide, please. So a little bit about the Alzheimer's Association. We mentioned at the beginning that I am a volunteer on behalf of the Alzheimer's Association. So I will read you our mission statement. The Alzheimer's Association is the leading voluntary health organization in Alzheimer's care, support, and research. Our mission is to eliminate Alzheimer's disease through the advancement of research, to provide and enhance care and support for all affected, and to reduce the risk of dementia through the promotion of brain health. Our vision is a world without Alzheimer's disease. So I hope that some of the things that we've gone over today, or even the second part of our presentation that will be happening at the same time tomorrow, gives you an idea of the type of resources that are out there. Next slide, please. So some of the resources that are available, I would recommend to you this phone number right here, 800-272-3900. I would absolutely recommend that everybody save that to their phone. Even if you don't know somebody with Alzheimer's disease, you might be at the grocery store, or you might talk to a friend tomorrow. That just needs help. So this is a 24/7 helpline. Anybody can call with a question. They can call and say, I need help finding a support group. They can call with any information that they would need about Alzheimer's disease. Like I mentioned, this is 24/7. Everybody that answers the phone is a master's level clinician, so they will most certainly be able to get you to the resources that you need, even if it's something that you're looking for locally. There's also information available at alz.org. There's a wealth of information to share with family members or to ask questions. There are also virtual support groups available on this platform. If going in person isn't something that's available to you right now, there's lots and lots of information. And then there's also something called alz.org/CRF, and that stands for Community Resource Finder. So if you're looking for specific things in your community, for example, if you're looking for home health, if you're looking for nursing staff to help inside your home, they will give you options that are available within your zip code, and you're able to click through and see the types of services that they offer, and phone numbers as well to see if that might be something that's right for you. But there are many, many other community resources available there as well. Next slide, please. Okay, ways to join the fight. As mentioned, the Alzheimer's Association is a nonprofit. In the survey that we mentioned at the beginning, the Alzheimer's Association is grant funded. So if you are able to fill out that survey, we would greatly appreciate it. Essentially, the survey just says that I gave this presentation to you today and that you learned something. If you have any recommendations or any ways that we can improve, that can also be included, but I do encourage you to fill out the survey if you're able to. Next slide, please. So there are ways to volunteer. There are many, many different fundraising types through the Alzheimer's Association. The main fundraiser is called Walk to End Alzheimer's. Some of you may have heard of that. For the Tampa, if you're in the Tampa area, there's actually a virtual event going on this Saturday, so it's certainly not too late to sign up. So that would be at alz.org/walk. So it'll give you all of the information on how to sign up. There are also several other volunteering events that go on throughout the course of the year. And if organization is what you like to do, they're always looking for volunteers to help with those sorts of events as well. The next on our list here is advocacy. So the Alzheimer's Association is a huge advocate, both federally and on the state level, for funding for Alzheimer's disease research and care. So there's an organization that's a sister organization to the Alzheimer's Association called Alzheimer's Impact Movement, AIM. And that group focuses on pro-Alzheimer's legislation. And my favorite point about that group is they are not red, they are not blue. If you mix the two colors together, you get purple, which is the color of the Alzheimer's Association. So they are a nonpartisan group that just advocates for pro-Alzheimer's legislation. Trial Match is a service that will match individuals to clinical trials that are enrolling in their area. The presentation tomorrow talks a little bit about clinical trials and research, but signing up for Trial Match is very, very easy. It takes about a minute, and you can see all of the different types of clinical trials that are happening in your area. And you can either be a healthy volunteer or you can be affected by Alzheimer's disease. So they're looking for all different types of people. And as I mentioned, the Walk to End Alzheimer's happening this Saturday in Tampa, if that is something that you're interested in. But I believe that is the end of our presentation. We can go to the next slide. And I'm happy to take any questions, or Amanda, if there is anything else we can answer.
Okay, thank you so much, Kaylee. That was a lot of information, a lot of good information. So while we, before we get into the question section, I do want to remind everybody it is there in the control panel. We'll give them a few minutes to kind of submit their questions. While we do that, I am going to remind people that, as Kaylee mentioned, we actually have a follow-up program tomorrow with the Alzheimer's. Kaylee will be back, thankfully, with us on behalf of the Alzheimer's Association. So we are going to put that registration link right in the chat section. So you can just click on that and register if you want to come tomorrow. Tomorrow is going to be, the program is called Alzheimer's is Not Normal Aging. So if you want to tell us a little bit more about that, Kaylee, what will be involved in that so people can register for that one, feel free to let us know.
Sure. So tomorrow we'll talk a little bit about some of the current research that's going on. Pretty much every week I have somebody call me and say, "Hey, I heard about this, news headline, news story. Is this something that's happening, or is this something that I can access locally?" So we'll talk a little bit about what's going on at the national level, but also what's happening locally. Then we'll talk a little bit about the diagnosis of Alzheimer's disease, what to do if you've had the diagnosis, or what to do if you're seeking a diagnosis as well. So a little bit more kind of boots on the ground, what's happening with families that are actively dealing with memory loss or Alzheimer's disease.
Very nice. So if you are interested, that link is in the chat section, but also the link for their survey for the Alzheimer's Association. Please, if you have time, click on that link and fill that out after the program. I am going to remind you, so that is a program upcoming class we have tomorrow. If you want to find out about any other upcoming classes and events we have, you can always visit us at hcplc.org/events to find all of our upcoming schedule for programs, classes, workshops, everything that's coming up. Or if you have any questions about the library, using your library card or what we are doing right now, give us a call at 813-273-3652, or you can always connect with us online at hcplc.org/connect. Okay, I'm going to go ahead and take off the screen for now so we can get into some of our questions, Kaylee. So our first question is, does the Alzheimer's Association advocate for unpaid caregivers, such as tax deductions for those taking time to provide unpaid care in the home?
So that's a very specific question. But yes, certainly anything that is pro Alzheimer's, pro caregiver, there are certain specific, bills and things that are moving through both the Florida level and the national level. But certainly I would look into that Alzheimer's Impact Movement, AIM, for the specific things that they are supporting. But I'm going to say the answer to that question is probably yes.
Okay, and then this we've kind of touched base on a little bit, but I think we're going to find out more tomorrow. But what Alzheimer's research is ongoing in Tampa?
Okay, that's a great question. Yes, we're going to talk a little bit more about that tomorrow. I'm going to give you a website. In addition to the website that the Alzheimer's Association runs, the Trial Match program, There's another website called clinicaltrials.gov, G-O-V. And what you're able to do there is type in your zip code. You can type in the research term that you're looking for is Alzheimer's, and you can do a search. So within 10 miles, 25 miles, however close to your home that you would like to look. But that's also a very, very helpful tool because it will show you everything that's going on. If you want to search the entire United States, it's also open. But that will show you there are several local research organizations that are in Tampa as well.
Okay, and I did just put that in the chat section, the website you just shared with us, Kaylee. So here is another question. You mentioned that your primary care physician it will, as part of Medicare, will do a screening. Should offer at least offer an annual screening when you have your visits, your annual doctor's visit. To get a diagnosis for Alzheimer's and dementia, would that come from the primary care physician, or would you need to be referred probably to a specialist? People want to know.
That's a great question. So most likely, if you have the memory screening in your primary care physician's office, usually it only takes about 10 or 15 minutes. That is not enough information to make a full diagnosis. And I would actually advise if your primary care physician says, hey, you have dementia based on a 10-minute test, that's not what you want. So either, if they're able to refer you to a neurologist or possibly a neuropsychologist. So it depends on your specific situation, but there are more tests certainly that should be run in order to have the official diagnosis of Alzheimer's disease or even of dementia.
Okay. And we have another question. So this isn't seeking really medical information, but in terms of, you see a lot about books about anything that has to do with, part of the human diet. You see a lot of books for brain health.
Mhm.
What is the feeling, from the Alzheimer's Association side or from, clinicians in terms of, or like memory tricks or things that can prolong your brain health? What is the feeling on that? Are those helpful or scams or maybe somewhere in between, or what kind of information can we get on those?
Sure. So that's another really great question. We think about in terms of exercising your body. We know that, a good diet, exercising, keeping moving is very, very good for your entire body. So there's also a term that says, what's good for your heart is good for your brain as well. So we see things like the Mediterranean diet. There's also kind of a spin-off called the Mind diet, MIND. It's a very, very similar diet. But as far as any, medical foods or supplements or anything like that, there's really nothing that's been proven. So, we want to eat things that we know are healthy. But, there are things like supplements that are out there. And those are actually they do not have to seek FDA approval. So I would just be wary of anything that says, it can reverse, the symptoms of Alzheimer's disease or anything like that, because we know that there's nothing currently available that has been proven. So I would certainly, talking to somebody like a nutritionist or talking to your primary care physician, it would be helpful, but there's no, 100%, exercise, eat right, and also keep your mind active. We know things like crossword puzzles and learning another language and things like that. As much as you can physically exercise your body, think about exercise for your brain as well, and something that's a little bit more challenging than you would do normally.
Okay. Well, I think that is the end of the questions we have for today. We will be back again. We will be back tomorrow. So if you do have anything that you maybe comes up overnight, you think of, we will be back tomorrow at 11 a.m. with our second program in this series. So thank you to Kaylee and the Alzheimer's Association, and thank you to everyone for attending. We hope we will see you tomorrow.
Thank you very much. Have a great day.
Bye.